Okay, thank you, Karian. Thank you again for the panelists who commented with you your results and Antonieta's results. And now give the floor again to Karam from the ECDC, and he will have a word on the ECDC work to support COVID-19 vaccine strategies in European Union.
Thank you very much, Olivier. I hope you can hear me and I hope you can see my slides well.
Yes, but it's not in the show mode. We see your slides, but not the...
Let me try again. Is it better now?
Perfect.
Very good. Thank you for inviting us once again to address this to the final event of the joint action. It's very exciting to learn and to see everything that has been produced during these 3 years, and especially the amount of and wealth of knowledge that has been created despite the fact that a lot of the work has been undergoing during the pandemic. So the goal of my presentation here is to show you a little bit of the work that we have been doing in support to COVID-19 vaccination strategy rollout and deployment in EU member states. This is really what has kept us busy, of course, over the last 2 years. So I will show you the work that we have been doing and some reflections on the way forward and how we see the future, of course. To start with, just a little bit of background on the policy and legislative context in which we operate, which I think everybody is well familiar with. The Council recommendation that were approved in 2018 continue to be critical. And the instruments that they have called for set up at European level are instruments that we have been able to leverage and to use during the time of the pandemic, and to really enable us to put in place platforms and structures that we wouldn't otherwise have had, and that have revealed themselves to be very critical for the exchange between countries and for the work that we have been doing in trying to support member states in setting up their COVID-19 vaccination strategies. Obviously, throughout the pandemic, the Commission has come up with a number of policies that have been made public through their Commission communications, outlining essentially the new actions or the interim actions during the evolving stages of the pandemic that we also as agencies, including ECDC, were required to undertake. And that obviously has significantly affected the work that we have been doing. And then finally, last but not least, and this is what is coming next, is the proposal as part of the European Health Union to amend the regulation that establishes ECDC. And this is, of course, a critical document for us. It's what is going to mark the future and how ECDC is going to operate following the approval of this new regulation, and building on the experience and the way that we have been working in a large way during the pandemic. So we started on, of course, very early on, even before the vaccines were available, to try and support countries in reflecting on the aspects that were needed to develop vaccination programs for COVID-19. So the different components, the different categories that countries were to take into consideration in order to have a successful national and EU level COVID-19 vaccine deployment plans. We've also been working with countries to develop prioritization strategies, particularly in the initial stages of the rollout of the campaigns, considering the limited supply that we knew would be characterizing the early phases of the rollout. We've been working together with the countries, together with the Commission and the Health Security Committee, on a number of stress test and preparedness exercises that were really geared to try and prepare more from a logistical side and operational side to prepare for the rollout of these vaccines, taking into consideration the specific characteristics that we knew they would present and the challenges that would come along the supply chain. Since the early stages of the rollout, we've been regularly monitoring what have been labeled as the National Vaccine Deployment Plan through the so-called ISAP process that have been established by the Commission. Essentially, we've been producing regular reports with a high frequency that were aiming at documenting vaccination strategies, the evolution in vaccination policies during the rollout throughout the different stages of the pandemic, and informing on specific initiatives of different situations that individual member states were facing. And we've been publishing 8 editions so far, and a 9th edition is due to be published by the 31st of March, so at the end of this month. And these have been critical because we believe that this documenting of the different national vaccine deployment plans is what has really enabled us to learn what structures and mechanisms the countries have put in place to meet the challenges of rolling out these mass vaccination programs, but also documenting a lot of the good practices. And one of the future things that we aim to look at within our program is to see what learnings we can draw from the way COVID-19 vaccination programs have been rolled out going into the future, and what can be transitioned and applied and used as a lessons learned for the implementation of routine vaccination. Our NITAX collaboration platform has been very critical for the dialogue and the exchanges between the countries. And my colleagues that work on this project have provided me here just with a list of the main topics that we have been dealing with throughout the pandemic. In 1.5 years, essentially, we've been holding more than 20 workshops or webinars that have been dealing with different topics just as the situation was evolving. And the focus here has been on the rapid sharing of information, rapid sharing of evidence, and rapid sharing of country experiences to try and understand the scientific rationale underpinning different strategies and different approaches undertaken by the countries. And this very much goes back to the discussion that we were having earlier with regards to cross-border collaboration, where we've really tried to play our role in facilitating this early on dialogue and sharing across countries. This has been a little bit different from the original intent that we saw for the NITAX collaboration, but we believe it has been also a key learning experience that we will take forward in reflecting about the future of how the NITAX collaboration will be sustained by the ECDC moving forward. We provided a large number of technical guidance documents on vaccination strategies throughout the pandemic, on the benefits of full vaccination, the implications on non-pharmaceutical interventions, which have been regularly updated at different stages of the pandemic, guidance regarding partial vaccination, vaccination following a previous infection, heterologous vaccination schedules, but also providing information on public health considerations for the provision of additional COVID-19 vaccination, on boosters, the vaccination of children, and the vaccination of adolescents. And all of this information has been regularly produced, also in close consultation in many instances and in discussions with the NITAX themselves, which have helped us to come up with the final public health considerations that we issued at European level to inform the next stages of the vaccination strategies at European level. A critical item that we've been able to work on as well has been the establishment or the launch of the establishment of a strong infrastructure across Europe for the monitoring of COVID-19 vaccine effectiveness and impact. So the establishment of infrastructure to enable us to really study how these vaccines perform in real life. And this has been possible thanks to an additional contribution that the Commission has granted to the ECDC of about 7 million a year, a contribution that is expected to continue through to 2026, and that we have been implementing through what we call VEBIS, our Vaccine Effectiveness, Burden and Impact Studies project, where we started 4 multi-country studies on vaccine effectiveness in the settings and against the outcomes that you see listed in this slide. This will be critical also moving forward into the future. As part of the new mandate, the Commission has specifically asked ECDC to work more closely with EMA on the real-life monitoring of vaccines in the post-authorization phase, vaccine effectiveness, vaccine safety, and this will continue to be a very important flagship area of work that I think many of us have been advocating for, particularly in terms of sustainability of funding at EU level, and that we hope we will be able to even build further upon. The initial scope of the work is on COVID-19 vaccines, of course, due to the emergency, but the plan is that this infrastructure be expanded and take back other priority vaccines as well as part of the routine immunization programs. And this brings me exactly to the work that we have been doing in joint partnership with EMA throughout the pandemic. We've been working closely with EMA all throughout, particularly on the topic of vaccines and on the topic of immunization. But I think we can safely say that this collaboration has been particularly strengthened during the pandemic. And we've been able to work in trying to bridge in a more sustainable way and establish a more bespoke dialogue between the public health authorities and the regulatory dimension of vaccine assessment. And this has been possible by bringing closer the two agencies and by bringing closer the networks of the two agencies. We've been able to more regularly participate in EMA regulatory meetings, and EMA has been regularly part of our NITAX meeting, particularly on the discussion that concerned the safety of the vaccines that were being authorized to fight COVID-19. But we've also been able to launch a first pilot in relation to what I was mentioning before, in relation to the enhanced post-marketing monitoring of COVID-19 vaccines, with ECDC primarily leading on the effectiveness studies through the VEBIS project that I showed you just in the previous slide, and EMA primarily leading on the safety side. However, throughout the pandemic, we've also been regularly working on issuing joint communication that have been critical on several topics at different stages of the pandemic, bridging between the public health and the regulatory side of the evolving situations. And these were communication at large to the public, to healthcare professionals, to stakeholders, and to the member states to really strengthen our joint voices and united efforts to have consistency in the recommendations that we believe countries should take in the further rollout and implementation of COVID-19 vaccination program. And we expect this partnership, of course, to continue along these lines. And as I was mentioning, because of this request, on the ECDC and also on the EMA as part of the new mandate to work more closely on the post-authorization monitoring of vaccines, we are currently working on carving out a collaboration agreement and trying to outline what will be the division of tasks and the principles of collaboration in this area between the two agencies. But this is definitely a game changer that we've experienced, bringing together this public health and regulatory dimension, which was very much needed at European level. In essentially no time, we've been able to also establish what we call the ECDC COVID-19 vaccine tracker to enable us to monitor the rollout of COVID-19 vaccines. And this has been possible largely thanks to the collaboration and the great effort of all of the member states that have helped us in setting up this system and in reporting the data in a very timely way to ECDC. What this allows us to do is to develop a proxy of vaccine uptake by receiving information from the countries on the vaccine doses that were received through the advanced purchase agreements and the vaccine doses that were administered. And we've been able to create a very rich database, a very rich platform that you find on our website, or that you can search just by typing in COVID-19 that enabled us to monitor not only what was the uptake for different target groups by doses, by country, etc., but also enable us to understand what was the speed of the rollout and eventually discuss specifically and individually with countries the specific challenges that were being faced. So the COVID-19 vaccine tracker has a large number of variables, and the countries have been working relentlessly to help us to work on the completeness and the accuracy of these variables, but also to ensure consistencies with the data that is published at the national level. And we are currently in a reflection process to see how we can transition to a lower frequency, decrease the burden on the member states, decrease the burden also on ECDC side, of course, in terms of the data that we upload and that we provide through this tracker. This data has been critical, and it has given us the opportunity to develop a very rich number of ECDC outputs, not just the tracker itself, access to the downloadable open data, specific country overviews, and also the so-called vaccine deployment report series, as well as infographics that have been used for social media sharing and dissemination. This system has been put in place in a very rapid way to rapid understanding of what was happening for the rollout of COVID-19 vaccination programs. But we believe that this is a model that we hopefully can use and can tie in also for the further reflections on how we can expand ECDC's ability to collect coverage data in the future for other vaccine preventable diseases, which is a critical part of the new mandate and what ECDC is asked to do in the future, even asking ECDC to have this data not only at the national level, but also at the regional level. And we certainly have a lot to learn and to see in terms of what we can do, also taking up the discussions that have taken place earlier this morning with regards to your pilot in using IIS, which we believe is critical, and we intend to take forward that discussion with the work package leaders to see what we can do in that area in terms of sustainability. And of course, last but not least, a few words on the area of vaccine acceptance. I will not spend too much time here because I know that you will be discussing this further in the context of the work that has been done by the Joint Action Work Package 8, Jonas, Antonietta, and the other colleagues, which we believe is great work that we can also learn from and that we need to reflect on in terms of how to take it forward. But specifically when it comes to the COVID-19 vaccines, we have seen new things, we have seen new facets of the issue, but at the same time, we are also mindful of the fact that the common concerns and determinants of low vaccine have also been very much in line with those that we have historically seen for other vaccines, particularly in terms of the safety, the perception of the disease, the effectiveness, the differences in behavior across different age groups, etc. And we've also seen that these issues around hesitancy, just like they are for many of the other vaccines, tend to be very complex, context-specific, vary across time and across place. So this tells us that the determinants and the categories along which we need to work remain the same. Of course, with the fact that we've had an exacerbated situation due to the increased attention on the COVID-19 vaccines, the novelty of the way these products have been developed and how they function, and also the more rapid spread of fake news, which have presented, of course, a number of challenges. But again, another confirmation that we've seen of what we knew already from peace times is that healthcare professionals at large, doctors, nurses, and pharmacists do remain the most trusted source of information to members of the general public. And this has been confirmed on and on by national studies that have been undertaken during pandemic, but also by the Eurobarometer studies that have been undertaken at European level. And this reminds us of the importance of continuing to invest in this area, or to also finding out more about the work that has been done by our Belgian colleagues in Work Package 4 in that regard. We ourselves at ECDC are endeavoring to invest in this area, particularly frontline healthcare workers, to training activities, to try to bridge the gap in vaccine acceptance, to increase motivation for vaccine uptake using motivational interviewing techniques to upgrade the skills of frontline healthcare workers, and also to upgrade skills in fighting misinformation. And we are working currently on the development of e-learning modules that are being piloted, being finalized, and we hope will be released and available already by May. And last but not least, a word about the European Vaccination Information Portal. This is our ECDC coordinated platform that we developed jointly with EMA and with the European Commission, called for by the Council recommendation from 2018 that I mentioned at the beginning of the presentation. It just reminds us of the importance of a clear and consistent communication to the general public. And this is a special platform that we developed separately from our corporate websites, where the target is really the lay audience, and we try to talk in a simpler language to the lay audience. The objective of this website is not to be a promotional website, but is really to provide as objective, accurate, authoritative information as much as possible with the latest evidence that is available on vaccines and vaccination in a non-technical language. It was launched in April 2020, and it has been, of course, a critical tool that we've regularly updated during the pandemic, specifically for the sections related to COVID-19 vaccines. The advantage of this webpage is that it's available and regularly translated in all of the EU languages. And for us, the goal is really to increase the consistency of information that is available on the online space regarding vaccines and vaccination, and to corroborate the information that we know all of you, all of the public health authorities at the national level are endeavoring to provide to their citizens and members of the public. And here are just a few concluding thoughts and reflection from my side, which is really about the fact that sustainable and resilient vaccination programs with a solid infrastructure during peace times are critical to the success of vaccination in crisis times. And we've seen this very clearly throughout the pandemic, with countries doing best when having in place the most solid infrastructures and the strongest sustainability to be able to monitor the performance of their immunization programs already in peace times. The joint action on vaccination has clearly built an incredible wealth of knowledge and recommendations on how we can strengthen the sustainability of immunization programs in peace times. And we believe that work must be done certainly to integrate all this knowledge into EU and national efforts. And as I was mentioning earlier, it has not been possible in many regards to have this discussion on sustainability for several of the work packages of JAV, but ECDC will work even after the joint action is officially concluded to better understand the products that have been produced and to see what is it that we can take forward, what we can learn from. And certainly we can learn from the COVID-19 vaccine rollout experience overall in general. It has broken down critical barriers, we believe, in the planning, monitoring, and implementation of vaccination programs. And there is no reason for going back to the previous status quo. So we certainly have to take stock of what has rapidly been put in place and see how that can be transitioned to the implementation of routine vaccination programs. The forthcoming amended ECDC mandate will empower us to do more in this area, to continue to strengthen work on immunization, better integrating it into the prevention, better integrating the work on vaccination on the sustainability of healthcare systems, more specific work on vaccines as part of preparedness chapter, and of course, more work goes on the routine monitoring of national vaccination programs, particularly mentioned earlier on monitoring vaccines in the post-authorization phase, but also monitoring of vaccination coverage. And finally, we must continue to understand and document the enablers and barriers of successful implementation of vaccination programs and continue the dialogue across all stakeholders. And I think the joint action has done a great job also at documenting practices. And this is something that we believe is fundamental for cross-border collaboration, as we were discussing this morning, and is something that we would for sure continue to take forward as ECDC. Thank you for your attention.
Thank you, Karam. Thank you for this very interesting and large presentation. Do you have finally a bit of time for some questions?
I have just 3 minutes.
Okay, I have just a remarks. I was very interested in what you were saying regarding the work with all the NITAGs in Europe, and indeed all the sessions that have been organized on those different topics related to COVID-19 vaccines. You have already said some words, but can you please tell us how ECDC is imagining the 2 coming years or the 5 coming years in words of NITAG collaboration, harmonization, Europeanization?
Yes, thank you for this question. We are currently just in the reflection process exactly about that. And in fact, what is happening is that we are reviewing the terms of reference that we had drafted at the very beginning when the NITAG collaboration started. For us, it remains critical, of course, to safeguard the independence of the work of the NITAGs, but also the understanding of the differences in vaccination strategies or policies that are recommended by NITAGs at the national level. But we want to work to increase the consistency of the way the common evidence behind vaccines is looked at and increase the cross-sharing of scientific products across NITAGs. And this has been an intent right from the very beginning. It has not been possible for us so far to implement the intended objective of the collaboration of NITAGs as it was meant to be because of the pandemic. But the pandemic has shown us also how we can more rapidly engage in dialogue and share information between the NITAGs, but also bridging between the NITAGs and the regulatory bodies, particularly in the situation of newly approved vaccines. So this is something that will for sure continue to be critical and feature in the next 2 years. And we are currently draft report that you have produced on the work on the NITAGs and the recommendations that have come out from the survey that you have done. And for us, a critical goal will be also to see how those recommendations can be taken on board and integrated going forward in the work of, in the revision of the terms of reference for our collaboration.
Okay, thank you for your answer, because I have the feeling that everybody among the NITAG are now used to have those meetings and will seek to have such meetings in the coming years. Is there another question or remark? No. Okay, so thank you again, Karam, for being there today and for this presentation. Thank you.